quickly, this became a real interest of mine from working in community mental health for around 20 years and seeing the way in which burnout affected really all of us: physicians, social workers, counselors, family members, peer support specialists, all of us. And when I finally became, well, I shouldn't say like that, when I became a director at Frontline in Cleveland of Frontline Services, I went after grant money, which we actually got, and that's meant to be a little bit of a hopeful message because people told me that that wouldn't happen. I got grant money to support staff resiliency efforts and to implement trauma-informed care with both a patient-centered and a staff-centered focus. So I'm going to kind of talk about some sort of common themes around burnout, vicarious trauma, and compassion fatigue, help us recognize some of the symptoms of that, but then also to kind of flip that over to understand ways that on an individual level, because I know that not everybody is full of really a team per se, how you can do some individual work with yourself around boosting your own resiliency and optimism and well-being, but then also some things that you could perhaps do as a team or as part of a system. So this, you probably saw this slide before. SAMHSA developed, or oh, I'm sorry, that just went back. Trauma-informed care programs essentially realized that there's trauma affects many of us. I'm sorry, this keeps doing this. Sorry, I'm being traumatized by my PowerPoint right now. So trauma-informed care programs essentially realize that trauma affects all of us, including providers and staff, as well as clients. And if you recall the ACEs study, which I know some of you were on, it really demonstrates how even populations that we may not think have experienced trauma may have experienced trauma.
I'm sorry.
That's okay. I can do my best with this. It involves recognizing the signs and symptoms of trauma in patients, families, staff, and other stakeholders. It really likes that next slide. And then responds
EMDR.
by fully integrating knowledge about trauma into policies, procedures, and practices. So I like this quote: the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. The way we deal with loss shapes our capacity to be present to life. We burn out not because we don't care, but because we don't grieve. We burn out because we've allowed our hearts to become so filled with loss that we have no room left to care. And that to me sort of speaks to experiences I've had when I've kind of monitored my own resiliency and well-being. So burnout, first of all, is defined as an extreme dissatisfaction with one's work. And typically, it's perceived as sort of the demands outweigh the capacity to keep yourself well. And it's typically thought of as more of a systems level approach. So oftentimes, like for example, things that can lead to physician or staff burnout might be productivity standards. It might be the electronic medical record. It might be a PowerPoint that's going bonkers.
Or not.
Woo. Okay. So essentially, burnout is really sort of like the way in which the system is affecting us. And we're going to look at some research around physician burnout in a moment, but I want for our counselors and social workers and other professionals, family members on board, the research suggests that, okay, we think we're good. Okay. So this data really kind of maps on other providers too. So, I wanted to sort of highlight physician burnout because oftentimes that's something that's not as discussed. But just for you counselors and other professionals out there, these experiences happen with many of us and at about the same rate, around 50% at any given time. So this was a research done by Medscape. It's a 2017 survey. And it just, it basically is an assessment that physicians got across disciplines, as you see. And and based on these percentages, these are folks who scored high in burnout, essentially, at that point in time. And something to note, Medscape's been doing this research for quite some time, and they found it continuing to increase, essentially. So the burnout rates, as they've been doing this, have continued to increase across time. So that's something for us all to be sort of mindful of. And even I know at Neomed here, we're concerned about student burnout. And there's more research about graduate programs as well for counselors, social workers, psychologists, where there's burnout already starting in your training. So here's some of the reasons that physicians describe burnout. Too many bureaucratic tasks, spending too many hours at work. Some of the other things a little bit below: compassion fatigue, overexposure to death, violence, and or loss in patients, family stress, because we're all people too. We have our own issues that happen. And I know for me, when things are hard at home, my gosh, it's really hard to be resilient at work. So it's sort of, that factors outside of work can also contribute to burnout, because it's sort of the candle being burned at both ends. So vicarious trauma is a slightly different concept. And this is essentially, you can look at the PowerPoint, but it's essentially when those of us witness suffering, elicit people's stories of suffering, see suffering in families' faces when we're working with patients, experience loss of patients. Some argue that we have a sort of a traumatic experience ourselves, which is described vicarious trauma. And a lot of the symptoms are very similar as someone who directly experienced trauma. And this is where I'd also say many of us, probably some of us on this line right now, have experienced trauma ourselves. So if you're a provider, physician, counselor, social worker who has experienced trauma in your own life, and then you're working with folks who've experienced trauma, it can be quite easy to be triggered, especially by people's experiences that may relate to yours. And I always sort of, with staff I've worked at, I'd go ahead and assume that people have experienced trauma. It's sort of a safer, universal precautions way to go. If they haven't, no harm, no foul. You're essentially just being compassionate and empowering with staff members and folks that you're working with. But oftentimes issues that come up are like safety, trust, control, self-efficacy. I'll just give a quick story about this. I'm a father of a 12-year-old and an 8-year-old. And I worked a lot of my life with children who'd been abused and were involved in child welfare system. And I realized, it was really with my son who's older, that I was very concerned about him going to people's houses in a way that wasn't particularly helpful. And I realized that, my God, I've been exposed to so much child trauma. I began to see the world as dangerous for kids, when of course it's not. The research suggests there's actually less risk of children experiencing, in certain children, my population of my children, they're less likely to experience any kind of abuse or traumatic experiences. But nonetheless, I began to see the world that way. And that's something just kind of to monitor, these kind of irrational sort of beliefs or perceptions that you may have. Compassion fatigue is essentially when you've just kind of gotten exhausted around the work. And either burnout or vicarious trauma or both can contribute to this issue. And these are when you don't want to go to work. You don't feel compassionate towards your patients anymore. You feel somewhat cynical or jaded. They're just saying that. Those are some of the things. And essentially, oftentimes it kind of can bleed into your personal life too. I know at times when I've struggled with this issue, my wife has said, you really need to take a run before you deal with the kids, just to kind of get a buffer from my home life, from my work life to my home life. And I wasn't oftentimes aware of that happening to me. So these are just some sort of things to look out for. And I'd say cynicism is a big issue. Burnout, vicarious trauma, and compassion fatigue really correlate with a loss of hope for patients and a loss of hope that things are going to get better, even more on a macro level, oh my God, our society is going to heck in a handbasket, right? So this is kind of a joke, but kind of not. Tacos are potentially healthier than crystal meth, right? But one thing I'd say to this is I worked oftentimes a lot with populations who had substance use, with people with substance use disorders. And oftentimes my staff would engage in overeating to kind of manage the stress of working with that population. And they would oftentimes say, well, to themselves or whatever, well, I may have diabetes, but at least I'm not, smoking crack. But at the same time, they were engaging in a behavior that was harmful to them to manage the work. And I could see that, as staff would be working with these children for a while, their lunches would change, literally, and the amount of food they'd be eating would change. And they would talk about the numbing they would get from eating. I've also been this guy when you're really you're there and you just kind of want to argue with people and your mood is just irritable. Clearly that's a sign to watch out for. That's not good for you. It's not good for the people who love you. And it's obviously not good for your patients either. So here's some other things. Avoidance. Maybe you begin to avoid certain patients or certain topics or certain issues, isolating yourself. I can kind of stick on isolation. Oftentimes another pattern that happens is when we begin to experience compassion fatigue or burnout or vicarious trauma, we actually pull away more from our colleagues, and especially in a way that can be really helpful, where you're acknowledging these issues are happening. So, the way you're managing it is actually creating worse of a situation. Boundary issues, you can see all the other things. Some people work all the time. This kind of mindset that if I keep working and if I do my best, nothing bad will happen to my patients, right? Or you just don't even want to go to work. You're just done. And it's like, getting a mule to drag you there. So here's some self-assessment tools. And actually, this is where I'll kind of say, when I was director of family services, I really believed that my staff's resiliency was as important as any other clinical issues that we brought up. So we had group supervision typically once a week. 1 out of 4 of those I would not attend because I may have been the source of burnout or what have you. And there'd be somebody else who would facilitate meetings with my staff around their own resiliency. And we use the compassion, satisfaction, and fatigue burnout scale so that staff could kind of get a sense of. The Maslow burnout inventory is another one. Both these are freely accessible. You can make copies of them, distribute it to people. So we would typically start with that, like doing the assessment and then seeing how we scored and then beginning to talk about it. So this is one thing I always say. To me, it's always been interesting that the same work that can burn you out is also the same work that can give you hope, right? I mean, there's a reason why oftentimes the 12-step communities and even Wounded Warrior projects and things like that, people who have suffered give back to other people who are suffering and then find hope and meaning, right? So it's interesting to me, how can it be both things? And I think it really depends on, like a lot of things in life, how do you perceive your situation? So compassion satisfaction is the flip side, right? And that's where you oftentimes characterize by continuing to be open-minded, having actually stronger relationships because you understand how important they are, finding personal strength, spiritual awakening, meaning, appreciation of life, calmness, clarity. Again, I worked with children who were homeless and parents who'd been homeless and had experienced trauma I couldn't imagine. And that actually, oftentimes when I was complaining about my own situation, it was sort of a nice refresher of like, wow, things could be a lot worse. I kind of need to be hopeful about what I have and acknowledge what I have, right? So I'm going to go through a few kind of tips. Clearly, like prioritize competing demands, just good old-fashioned prioritizing. Brainstorming different ideas, and you'll see some ideas all throughout here, but and it's a little bit of a trial and error to sort of figure out what would work for you, what wouldn't work for you. I'm going to kind of get back to the take 10 minutes at work because we did a study where I work that I think is interesting. Delegate at home and work. People pleasing is a really easy way to get yourself very burned out. And if you're already working very hard to meet patients' demands and then you're going home and in your personal life, you tend to be somebody that says yes a lot, that can be really challenging. So sometimes you got to learn to say, no, I can't do that right now. Having a transition, I just mentioned when I was really in the thick of it, I would run in between work and then coming home. And assess trauma input. A long time ago, I gave up watching dramas that had trauma in them. It just was too much. Like I'm a American Idol person or whatever. I watch something funny or sports or something that has nothing to do with people suffering. I can't do it anymore. Certainly learning more about compassion satisfaction. Consider joining a peer support group, attending workshops, professional training. That's a nice way to keep an open mind and connect with other professionals. Physical activity, physical expressions like musical instruments, dancing, things like that. If you're religious or spiritual, clearly that can be a healthy thing. And scheduling regular pleasurable activities. In my family, every Saturday morning when it's nice out, we all ride to the lake and we look at the ducks and we spend a lot of time there. And it's a really rejuvenating experience. This is from SAMHSA, and this is what I do with my staff and with patients. These are all kind of domains that have evidence to suggest that they can boost resiliency and well-being. You can see they're very vague, which I think is nice because it gives people the opportunity to individualize. So we kind of go through them. I'd give them a couple examples of stress management, like diaphragmatic breathing, progressive muscle relaxation, healthy eating, physical activity, getting a good night's sleep, sleep hygiene stuff. Service to others might not be something you want to do since we already do a lot of that. Though I've known people who've done service to animals because for them, they volunteer at a non-kill animal shelter. It was very different than working with people, and they felt a lot of satisfaction. Support networks, the optimism. So oftentimes what I get staff to do too is just think about at the end of the day, what's one thing that you feel good about that you accomplished today? Because oftentimes when we begin to get in a mindset of negativity, all you can access is those more negative, distressing experiences. So it's kind of like exercise to think about the positive things that happened during that day. I usually would start every staff meeting with, tell me something successful that happened with your work today. That also kind of bleeds into cognitive skills to avoid negative thinking, spiritual beliefs and practices, and a sense of meaning or purpose. So essentially we would kind of talk about these domains and people would kind of trial and error, what made sense to them, and we talk about how it worked for them. There's a book called the Compassion Fatigue Workbook, Creative Tools for Transforming Compassion Fatigue and Vicarious Traumatization. This is the workbook that my staff went through without me. Again, I would work with the directors and we would do our own work. And it is important to think about power differentials. If you're a person in power, your staff probably don't want you to be a part of these meetings. They'd probably rather do it with themselves. But we found it to be a very helpful workbook. The Trauma Stewardship is an everyday guide to caring for self while caring for others, another really good resource. So essentially my staff would just go through this 1 out of every 4 staff meetings. And what we found is that the turnover in my department decreased. The sense of satisfaction increased and people's sense of well-being increased. And this was a strong argument to make to funders, by the way, because I would talk to anybody who would listen that the turnover of staff affects patient care. When you can begin to recreate the person's experience of abandonment and neglect when they have 5 different therapists across a year, or 7 different case managers, or 3 different physicians, right? It's like, oh my God, I just told my story and now you're gone. And that's kind of recreating that thing they've already experienced, which is not particularly helpful. And I found a couple of funders who actually wound up biting and made the choice to fund essentially for my staff to not have to worry about productivity for 2 hours a month so that they could do this resiliency work. I wanted to try and get more, but that was where we got. And I think that's a message of hope. It took me 2 years, and I talked about it everywhere I went. Everywhere I presented, I talked about that. And eventually I got some people to bite. So this is an interesting study, I think. This is not published, so take it with a grain of salt. But we did a study at it's Frontline Service in Cleveland, Ohio, where we essentially randomly assigned, and this was all staff. It was from medical director, physicians, social workers, case managers, peer support specialists, were randomly assigned to 1 of 2 groups. One group, they were instructed for 15 minutes just to do their regular old break, right? Whatever they did for 15 minutes, if they smoked, if they surfed on MSN, whatever, that was what they did. For the other staff, they were either taught a mindfulness technique for that 15 minutes so they could practice, or if they were religious and believed it was appropriate to engage in religious behavior at work, they would do that. And we tracked them longitudinally in both their sense of anxiety and their sense of sleep, or their experience of sleep. And what we found was that the staff, the biggest effect was the staff who engaged in religious behavior at work. Their sleep dramatically improved. I'm talking about, for many folks, it was about an average of 45 minutes of additional sleep per person. than what they had been getting, as well as a significant decrease in their sense of stress and anxiety. The mindfulness group also had a significant effect, slightly smaller than the religious group. And the other group that took a 15-minute dedicated break had no change over time. So we began to really encourage our staff to take 15 minutes, if it was something that was comfortable for them and fit in their way they see the world, to engage in mindfulness, guided imagery, progressive muscle relaxation, something, whatever kind of made sense to them. And we also wound up dedicating 2 rooms for the sole purpose of staff resiliency. There were mandalas in there. There was like a nice scent all the time. There were lazy boys. And the staff could just pop in there and have some resiliency time, some quiet time, and then get back out there and do the work. And we actually had those at Neomed too in the library. There's some sort of mindfulness rooms for the students. So tons of like resources there about that. But yeah, so I guess the take home message from my bias is that for us to do really good work and all the things that we're talking about on all of these calls, or these video conferences with our patients, my belief is we have to take care of ourselves first. And if even not for that, for just our own well-being and for our families. So I really see them as connected. I see our resiliency and well-being connected to good clinical care and good outcomes with patients. So that was my spiel.
Thank you. It's interesting. I came